Started. All right, y'all. Another episode of Testimonials with Herbal Results. And we are here with a sister that I have met for the first time, but we've known each other through social media. And we started doing some inbox conversations, and I thought it would be good if we captured the conversation on video just so we keep up with this library of
Hmm.
great results with the olive leaf extract and people going through healing. So why don't we just allow this young lady to
Hmm.
introduce herself and just, talk about your name, your age, your background, what you do professionally, and then we can just move on from there.
Okay. So I am Dr. Faison. I'm a doctoral prepared nurse practitioner. I have been practicing for 22 years. My certification is in family practice. Um, of course, in family practice, we deal with the same things, the majors, hypertension, diabetes, high cholesterol, all those things that can largely be managed through the lifestyle practices, but somehow we often find ourselves on the other side where we're needing to manage these things with medications, or at least under the allopathic model, we find ourselves managing those things with medications. Um, I would say I first started using olive leaf extract back in 2015. I do not remember how I came across the product. Um,
You talking about the
Although
herbal results?
Herbal Results, your product,
Mhm.
I've stuck with it. Um, I probably can say that I ventured off one time to get some of the olive leaf extract, because your Herbal Results is in such demand. Sometimes we can't get it, but the quality of Herbal Results olive leaf extract is unmatched. So I think probably most of my life I have embraced alternative medicine, although I practice um, under allopathic model, but I've always embraced more traditional approaches to managing my health for myself. So it's been a journey for me
Mhm.
in incorporating and investigating, products or substance supplements, I should say, that work best for me to manage my health. Now, for me, there is a family history of high blood pressure, diabetes, and so that was always on my radar to make sure I'm paying attention to those risk factors and the numbers. We pay attention to numbers. And so that's how I got started on that.
Yeah. Were
Just
you
to
were you having any of those issues yourself?
When I first started, no. Maybe a few years later, as my stressors have gone up and down, I have had some challenges with my blood pressure being
Mhm.
elevated, and probably more recently I have. And one of the issues for me has been consistency, especially when I did not have an issue. For
Mhm.
example, with my blood pressure, um, my results with Herbal Results olive leaf extract it's always been immediate and sustainable. So there are times when I find I would have taken the extract for a short period and my blood pressure was normal, even sometimes leaning towards the low side. And so
Mhm.
I would back up. And then when
Mhm.
I see my numbers creeping up again, then I pick it up again. And so
What's your
that's what's
highest numbers
happening.
then?
What's the highest?
Yeah, the highest blood pressure numbers you've ever had.
Between systolic between 150 and 160, which is
Okay.
a scary thing for me.
Okay.
When I'm used to being in the 110s to 120s. And
Okay.
so I know there's something going on, stress related, lifestyle related, when my numbers get beyond the 120s. When I'm even in the 130s, then I'm paying attention.
Okay.
So of recent, a lot of things going on, a lot of changes, in this healthcare environment. We're dealing, people are sicker. I'll just say it that way. So we're dealing with a lot. And so I actually was presented with what I would call in a hypertensive emergency. So being at that systolic 150, that's an emergency for me.
Mm-hmm.
Um, and in that moment, I did go on to a medication, probably some element of fear
Mm-hmm.
and wanting immediate results. And then I remembered, wait a minute, you have olive leaf. And so hence me reaching out to you.
Right.
What 2 days ago?
Yeah.
And I always try to keep one bottle on hand. So I do have one bottle already. But I always like to have my backup. And so I was traveling, and as soon as I got home yesterday evening, I took a dose of the olive leaf, and both systolic and diastolic, which is top and bottom number, down 10 points within the hour. So I always see immediate results for myself. Now, in dealing with patients, um, it's always been an informal recommendation. In the allopathic world, we like to be able to point to studies, what have you. And sometimes I don't want to deal with all of that. Um, my approach has been, or my experience has been that when somebody is ready and engaged with their health or
Mm-hmm.
managing their health,
Mm-hmm.
then it's not a fight. It's not this push and pull.
Right.
The recommendations have been received very well, and so there are two people in particular that come to mind. Two women, probably in their 60s, who one newly diagnosed diabetic. I told her, I said, go ahead and get started on the herbal results. I sent her the link so she wouldn't have to look for it. I told her, go ahead and get started with the herbal results olive leaf extract, and she did. In the allopathic world, one of the initial medications we used is metformin. They had already started her on metformin. Um, Her initial hemoglobin A1C, which is that 3 month average
Mm-hmm.
number, was over 10.
Mm-hmm.
Well, she started the herbal results olive leaf extract, and after 6 months, her hemoglobin A1C was below 5, and she was able to come off the metformin. Another woman that I came into contact in a class, in a vegetarian food preparation class. I'm sure you know him, Baba Dana Denard.
Yeah. Yeah.
We're in the class and just talking like we do. And she was talking about having such a difficult time with managing both her blood pressure and the diabetes.
Mm-hmm.
And of course, right away, what came to my mind was herbal results.
Right.
And we met every 2 weeks with this class. And within that 2 week time period, she said she had been back to her doctor. The doctor said to her, I don't know what you're doing, but your numbers have improved significantly. Continue. So I've seen this happen. I've seen this play out over and over again, specifically with high blood pressure and diabetes.
Mm-hmm.
And, I think that it's it's such a good result because those two specific disease processes kind of impact the body in similar ways in terms of the stressors on the adrenal glands, on the liver, um, and we've seen how the bitters, how they impact the overall liver health, and so that's one of the things people don't talk about when you're talking about diabetes. Somewhat you hear the impact of stress with high blood pressure, but you don't hear it so much when you start talking about diabetes.
Mm-hmm.
And it really is a component of that.
Yeah. So, what I found, and the reason why the olive leaf extract not only works for, and what's really good is because you're a doctor and you're seeing these things in real time. You're seeing it with yourself. You're seeing it with people around you. And what really most people are suffering from is metabolic syndrome, right? And this metabolic syndrome is also has a root marker based on inflammation. So
Mm-hmm.
what the olive leaf extract really does simply is that it reverses the inflammatory response.
Okay.
And what's going on with people is that So for instance, with hypertension, that's just inflammation of the arterial walls.
Mm-hmm.
Then you've got the issue of diabetes, which is really just insulin resistance. Now,
Yes.
the thing is that the hypertension can also be a result of insulin resistance too, because metabolic
Yes.
syndrome is always coupled with insulin resistance.
Mm-hmm.
People are eating too much and they're eating too much refined carbohydrates, which is causing a, they have high glycemic indexes in these foods, these processed
Mm-hmm.
foods, which is then causing an insulin outpouring in the body, which then creates insulin resistance because it's just insulin always being triggered. And that's what metformin does, is that it creates insulin sensitivity. But
Right.
the problem with metformin is one form of metformin was recalled a few years ago for causing cancer. And then the other problem with metformin is that if you look at
Mm-hmm.
the side effects of metformin, the first side effect uh, listed is death. Like literally, when you go to drugs.com, metformin side effects, the first side effects is death, and it's coming from
Okay.
lactic acidosis. So,
Yes. Mm-hmm.
so, you know, you're actually one of the rare doctors and medical practitioners who will give people an alternative from pharmaceuticals, right?
Mm-hmm.
You see people and you say, "Hey, try this." It's something that most doctors don't do because one, most doctors don't study plant medicine and they don't study
Right.
right? They don't study nutrition, but I think more and more those of us who are watching the results and seeing that, as you said, very, very, very poignantly and articulately, hope people didn't miss it. People are getting sicker. People are getting sicker. I mean, my email is full. My phone is ringing off the hook because people,
Post-COVID world,
yeah.
I mean, we're seeing things that we can't explain it. We never seen it before.
Mhm.
And we're throwing all kinds of medications, and it's just not working. It's not working.
No, it's not working at all. And it's like, what's the definition? One of the definitions of insanity is doing the same things and expecting different results.
Different
And
results. Yes.
yeah, and things are just getting worse. I mean, I mean, the CDC, more people dying from hypertension, more people dying from heart disease, more people dying from cancer. And then the cancer, what's going on, I'm sure you've seen it, is you've got these turbo cancers going on now,
Hmm.
being diagnosed with cancer and dying within 2 months, right?
Yes.
Because their immune system.
Sometimes even sooner.
Yeah, because their
Hmm.
immune system's just shot. And
Right.
so one of the things that we do is that I'm not really that interested in selling products, even though we make products. What I'm most
Hmm.
interested in is people learning, people becoming like you, basically, right? Everyone should become a practitioner. Everyone has a body.
Health. Right.
Everyone should learn how to heal themselves. And everybody should look at, and the crazy thing is that you talked about the scientific studies. The National Institute of Health website is replete with studies on things like olive leaf extract and how it reverses high
Hmm.
blood pressure. I mean, I have one study on the website. Whenever you have time, you might be interested to look at it. It compares uh, hypertension, stage one hypertension, and it separates people in two groups. One cohort is captopril. They take captopril,
Okay.
ACE inhibitor, like lisinopril,
Yes.
and then
Yes.
the other cohort took olive leaf extract. What they
Okay.
found out, was that the olive leaf extract reversed the hypertension just as well as captopril, but also
Hmm.
lowered cholesterol while it was doing it, while
Yes.
the captopril did not. And then we find out that there's a study from the American Heart Association that ACE inhibitors, like captopril, lisinopril, all of those things that end with pril, they're
Yes.
actually responsible for acute renal failure.
Yes.
The studies
They
are out
can.
there. They're clear. I mean, it's very clear that it's out there. So on one hand, as you said, when you talk about the allopathic thing, the allopathic doctors are trained to give people lisinopril, which is not going to affect their cholesterol levels in a positive way, and is not going to really save them from their kidneys, right?
No,
Failing.
that's
It's actually
right.
going to
That's
cause a
right.
renal failure. So on one hand, and then it costs a lot of money because these are patented drugs. And then you have something
Hmm.
that's natural on the other hand, which is going to lower your blood pressure just as well as lisinopril, but it will not cause acute renal failure. It will actually help build up and protect your kidneys and it will lower your cholesterol. So in a perfect world, between those two choices, all doctors should be choosing the choice that gives the least amount of harm. But
So here's the
yeah,
distinction. You can't ask, someone to do that which they're not trained to do. And you pointed
exactly.
that out. They're not trained, or the allopathic model is not training in plant medicine. And so, I have, so one of the hardest things that we deal with patients is getting people to engage and take ownership of their own health.
Hmm.
When I get those arguments from patients, by the time they get to me and they say, "Oh, I'm going to all these doctors and nobody's doing anything to me, or I'm not getting the results I want." So, and I say, "Well, what's the goal? What are you trying to achieve?" And once you realize and you understand what it is you're moving towards, or what health means to that person, then who is it you're going to? If you're going to an allopathic doctor, then that model is to put you on the pill. If you're looking for a different result, then that's not who you go to. That's not who you go to. Um, Also, again, back to getting people to engage. It's to doing the reading, to be in tune with the self, to know how do I react or respond to this particular thing, whether it be food or medication. That there's a process to that. And to get people to do that, that's one of the to get people just to be active. It's a struggle. It's a struggle.
Yeah,
But but on the other hand, I see these 90-year-old active, agile people, and and anytime I come across any of them, I say, "Wow, you're the poster for what healthy living is." But it's a struggle to get the average person to engage
right,
on that level.
right. And so what state are you operating out of?
I'm in Georgia.
Okay, so you're in Georgia. So you
I'm
in
in
Atlanta.
Georgia, but I'm licensed in 9 states.
Okay, so let's talk about you and your background. What got you interested in health and studying health?
It was what I always wanted to do from a little girl.
Mm,
Um, I made that decision as a child that I wanted to be a doctor. My path was slightly different. I did not go to medical school, so my doctoral degree is not MD. It's a clinical doctorate for nurse practitioners, and so I just took a different route. But I've always been interested in health and healing, probably more so healing. But the easiest way, or my understanding of what healing and health was as a child, was the allopathic model.
sure. And so,
Hmm.
like, what are you seeing these days? Like, we talked about it briefly, but let's just talk about. I want people to understand this because you're in the thick of it, and I consider you be on the to be a frontline person, right? Um,
Hmm.
what are you seeing? What are you seeing in this? Like, what's on an average day, what are you seeing in terms of people walking through the door?
Well, this respiratory stuff. Many people are not talking about the ongoing transmission with COVID, as well as respiratory airborne illnesses, but huge, huge, especially in this region. Um, I don't like to think of myself as a conspiracy theorist, but I'm just convinced there's something in the air, beyond this prolonged season of pollen. So first and foremost, it's all the respiratory stuff.
Hmm.
We're seeing heart issues related to um, post respiratory illnesses.
Hmm.
Those are the big ones. But and when you talk about the chronic illnesses, that's always there: the hypertension, the diabetes, the cholesterol issues, the kidney disease. That's probably 80 to 90% of what we see
Right. The metabolic,
regularly.
yeah, the
It's a
metabolic
lot.
disorders, right?
Say that again.
Metabolic disorders.
Metabolic disorders, absolutely. Yes,
And so
absolutely. 80 to
you
90%.
80, 90%, right? That would be the
80 to
basically
90%.
hypertension, diabetes, autoimmune illnesses, cancer, basically, right?
Right.
And your few
And like you
respiratory.
said, much rooted in chronic inflammation. It's ongoing across the board.
Absolutely.
Ongoing.
And so if it was up to you, what changes would you make in the medical system, the allopathic medical system?
So it has to be systemic. And one of those systemic things that have to change is around dietary measures and access. So when I'm talking to a patient, let's take somebody who's been diagnosed with diabetes, and I'm trying to get them to eat more whole, nutritionally dense foods. Well, if they can't afford it, what am I saying to this person? If that person lives in a food desert, what am I saying? I'm just talking.
Right.
It's just lip service. So it would definitely be access to foods, to healthy, nutrient dense foods. That would be one of the first things.
Right.
One of the very first things.
Right.
A couple of years ago, I had the opportunity to go to Cuba with the medical group. And one of the things that they have in Cuba, they call them neighborhood medical clinics. And the design of it, or the model, is where you have a doctor, a nurse assigned to communities. So they actually live in the communities of the patients that they serve. So they're very in touch with and aware of what the issues are in that community. And, part of the Cuban health system is, you get everything is structured. Let's say it that way. The dietary allotments is structured. So when it comes to health maintenance, you don't get a choice around that in that health model. If you don't show up for those appointments, then that doctor's gonna come to your house because they're right there.
Mhm.
So they're very aware of what's happening, what the needs are. Um, they're very in tune with the pulse, if you will,
Right.
of the patients or the people in those communities. And so I think with with our model, the Western model is so disjointed. Like, we have what we call evidence-based practices. We know when it comes to many things, how to manage it, how to minimize the issues related to it, but it's disjointed. There's no ongoing. The foundation of it is, the support is not there, and so it makes sense when I give you the example around food, for example.
Right.
Can you hear me? Okay.
Yes, I can.
Okay.
Let me do something real quick. I'm going to
Okay.
pause this real quick just to check
Okay.
my power source. I'll be right back. Give me 30 seconds. All right, yeah, let's pick on what you were saying. You were saying we're gonna pick up from there. You were talking about it's disjointed.
It's disjointed. Yes, it is. Again, we like to use this term nowadays, evidence-based practice. And so
Right.
the evidence is there. And so, the the lifestyles we lead, it's just it's almost like you're set up to be in
Thick.
the chronic state of
Yeah,
inflammation with the high cortisol levels. It's almost unavoidable because of the lifestyles.
absolutely. And people aren't
And I'm
going
talking
outside.
about myself too.
Yeah, yeah, it is all of us. That's why I spend so much time outdoors these days because, the whole vitamin D thing is a big piece. And I'm so flabbergasted that I have all these people calling me with cancer or different types of illnesses. And I always ask them, what's your vitamin D level?
Right.
I don't know. I said, so you were just got out the hospital. They didn't run a vitamin D panel on you? Nope.
No, that's not a normal test because it's expensive. Now, remember part of this machine, you have the insurance company, third party players, and then you got the pharmaceutical companies too.
Yep, yep. And
And
they're
and so I
overbilling
was
people. They're completely overbilling people because you could take a home-based vitamin D test for 35 bucks.
wow,
You know, you
yeah,
can get it off of Amazon, but when you go to the hospital now, all of a sudden, it's like airport, right? At the airport, you paying $8 for a bottle of water. You
right,
know what I'm saying? So you go to the
right, the
hospital, and
markup,
yeah, they're marking you up crazy at the hospital. But these vitamin D panels that are missing from people's health analysis is, to me, one of the biggest forms of malpractice because they know, I mean, look at what you said, respiratory illnesses. They know that vitamin D is actually responsible for how inflammation is handled in the respiratory walls. Like it's
yes,
actually one of the main things. And most of, I say it over and over again, especially when it comes to people with darker skin.
hmm
Most of us are walking around, particularly North America during the winter, we're walking around with vitamin D levels under 20,
right,
which is literally,
and,
and I say to people, it's like walking around with AIDS
right,
because you're just subject to opportunistic infections.
and it's so surprising, those of us who live in the warmer climates, that we generally tend to be outside more,
Hmm.
but the levels are still low.
They're still low. They're definitely not, they're not high enough, and we definitely aren't outside the way our ancestors used to be outside,
Absolutely, absolutely. We
you
tend
know.
to be outside more, but definitely not enough because
No,
we're doing all the other stuff.
right. Other stuff that's not even important in terms of our health, right? In terms of
Yes,
our health. And I mean, we're a tropical people, so we need to be in tropical environments, and it affects
right.
us, you know. I always point to a study that came out of Sweden uh
Hmm.
during COVID, and a lot of people who were dying from COVID in Sweden were Somali refugees. And they have a very liberal policy in Sweden on
Hmm.
refugees. So they had like whole apartment buildings, like what they call projects for all of these
Okay,
Somali refugees. And within 2 years, they had the worst health outcomes than any other group in Sweden.
I
And
believe that.
during the pandemic, they suffered the most. And what they found out was that all of them who suffered were vitamin D deficient. They had
Hmm.
D levels under 20. And when they were in Africa, when they were, by the equator, their vitamin D levels were much higher. And these are outdoor
Right,
people that you've now thrust into a winter environment. They're
right.
indoors all the time, and they're just getting sick because they get no exposure to the sun.
To the
And
sun.
sun exposure is free. It's free. And no one make money off
Yes,
of that, you know? I mean, during the winter,
right.
you can take vitamin D supplements, but the supplements are very cheap. We make it at Herbal Results. We sell it for 20 bucks. You know what I mean?
Hmm.
It'll last you a month. So it's like, um, we live in a world, in a society that does not equip us with the proper information to save ourselves,
Right.
you
But
know?
who's responsible? But whose responsibility does it become?
It
The
becomes
self.
ours. Yeah,
The self.
self. It becomes self.
You
And that's
know.
why like voices like yours is important because it's not like you're not talking from like hunches. It's not like it's not you have a hunch or like you think this. This is what you see every single
Mhm.
day. I mean, that's another way to really interpret an evidence-based medicine. We have the
Yes.
that what they're doing
Yes.
ain't working. We
Right.
got that evidence. You see it every single day,
Right.
which made you want to
Yes,
think about
absolutely.
alternatives.
For the past several years, so this is one of those areas where, I always say, I don't need to be right about everything. And this is one of those things where I want to be wrong about, but it hasn't shown to be so. And unfortunately, what we're seeing around the world is that health is now becoming a thing of the elite.
Hmm.
And it's an unfortunate thing, but that's the trend.
Right, right. Because they also know, a lot of them know that a lot of it is based on diet, lifestyle,
They have
nutrition.
access. That's
Yeah, then
right.
they have access to all of these things. And then a lot of these, you have a lot of doctors. I talk to a lot of doctors who are defecting themselves. They're
Hmm.
defecting from the allopathic methodology because they're seeing that allopathic methodology is just a rotating wheel for just pharmaceutical prescriptions. And
Mm-hmm.
see, they're not seeing the results. You know, some of them were very serious about being doctors and nurses and actually helping people, and they're seeing that they're actually
Right.
hurting more than they're helping, you know? And I've got so many stories, like heartbreaking stories, but I think it hits home when you have somebody who you love and they're going through the system and they're not getting better. Not only are they not getting better, they're getting worse. They're getting put on more medications to deal with the
Right.
effects from the original medications. You know, I mean, you see
Right.
this all the time, you know?
Right.
So you're saying that basically you would like to see something like what they have in Cuba, where you have a more integrated approach where the doctors are embedded in the communities. They become
Mm-hmm.
community. And then that
Mm-hmm.
also gives a certain level of accountability, right?
Yeah. Yes, it does. Yes, it does. And under the Cuban system, you don't get the choice of whether you want to engage or not. you
Right.
know so like, for example, when Obamacare rolled out, everybody was covered under insurance. Everybody was covered, but that didn't mean that because people had insurance now that they were actually going to go, at least for the preventative screenings. So that was the other piece of that. Okay, now
Hmm.
now you got access. What do you do? What's the
Yeah.
next step? And it
Mhm.
was it was for too many people, it was a ball of confusion. It's a ball of confusion, but you don't have that option.
Right.
In Cuba, you have to. It's part of their public health model
Right.
that every citizen will be engaged and have access to the health system.
Yes, yes.
And,
You
and,
know,
and by the way, with the blockade, I know that's a political term.
hmm.
Even with having so little, Cuba is at the top, is one of those countries that's out at the top with very good health outcomes that even rival, some of the top westernized countries.
Right. So, and it shows you it's not about the money, it's about the approach.
It's about the approach.
Yeah. And
It's about the approach.
I saw this in El Salvador, you know. I went to
Mm-hmm.
El Salvador 2 years ago or a year
Mm-hmm.
and a half ago, when they made, so I went for a different reason. I went because they
I
made,
remember that. You
yeah,
share.
yeah. And they had their pandemic hospitals. And
Mm-hmm.
they actually have one main hospital in San Salvador. And so when I went, you needed no test and you needed no vaccine, proof of vaccine. I was
Mm-hmm.
like, oh, this is very interesting. So you enter the country, you did not need to get those PCR tests or anything. So went
Mm-hmm.
to the country, then you come to find out that they took their main hospital, their biggest hospital in the country, and they made that their pandemic hospital. Well, when I
Mm-hmm.
went, it was empty. The hospital was completely,
Wow.
and this was in the height.
So they did something right.
Yeah, well, let me tell you what they did. Anybody who's a citizen who presented with symptoms
Mm-hmm.
were given a care package for free. And the care package had vitamin D, zinc, ivermectin, and Z-Pack.
Yes.
That's what they had for secondary infections.
Mm-hmm.
So everyone who got sick, the moment you presented with symptoms, you were able to get this package for free.
Right.
What that did was it kept people out of the hospitals.
Right.
Hospitals were completely empty. There was nothing going on. People were just
But that made sense. It
yes,
made sense from a national perspective,
yeah,
because the burden of managing fiscally, of managing, we're still recovering, aren't we?
yeah. I mean, you know it more than anybody. You know it more than
But we're
anybody.
still dealing with
You
it.
in the
We
trenches.
are, yeah, but we're still dealing with it. We are still dealing with active COVID infections. And I never stopped. In fact, I got the recommendation from you. The D3K2,
Yeah,
the quercetin,
yeah,
the zinc. I
yeah.
never stopped.
Right.
I never, because I'm still seeing patients.
Right, right. And so when you see the patients, so what goes on for you when you see the patients and you know a different method than what the hospital may recommend? I mean, how are you able to maneuver around that or maneuver with that?
So in conversation, I just say, you want to protect your immune system. You should be on things that protect your immune system.
Right.
You might want to get some zinc.
Right.
Have you heard of the D3K2?
Right.
You can go to
Right.
this health food store. So I just put it into the conversation.
Right. Right.
And in my documentation, I may say something to protecting the immune system without necessarily putting in the specifics of
Right.
what I told, what I said.
Right.
But
Right.
I'm always, but that's part of my normal conversation, even when I'm not talking to patients about
Right.
people being on immune boosters.
Right.
Um, and D3K2 is at the top of that,
Yeah.
and zinc,
Absolutely.
of course.
Yep.
Those two especially.
Yep.
When I come across people who are more or higher risk because of um, respiratory challenges pre-existing, then I may say to them, you might want to keep on hand the NAC, the
Mm-hmm.
acetylcysteine, for mucus and things of
Right.
that nature. So it's so
Yeah, I think it broke up for a second there. What was the last thing you said there?
I said it's so much a part of what I do that, to speak of that is part of my normal conversation.
Excellent. Excellent. So what I've done is I think this might be a nice follow-up conversation for us. Um,
Mm-hmm.
so, recently I've written a book on my experience with eradicating cancer.
Mm-hmm.
Cancer is actually caused by intracellular parasites and how we've been getting results. Like, what I mean by results, not remission, but like NED diagnosis, no evidence of disease, right? With that, there's been a lot of outpouring for people to get their hands on the protocol and all of that. And what we found is that, and this as well, you can have a protocol, but the question is getting people to actually do it in terms of compliance, right? Are
Right.
they going to take their vitamin D? Are they
Right.
going to stop eating donuts? Are they going to, you know what I mean? And so, we put together this Herbal Results Health Accountability Community. In the
Mm-hmm.
community, I think you'll find this interesting, and I think I'm going to tap in with you at a later date and we can talk this out more. But what it is that the community is a community where you have people who are sick, and then so it has three levels of people: people who are sick, people who used to be sick with a particular illness and are no
Mm-hmm.
longer sick with that illness, and then people who are healthcare practitioners who actually care
Mm-hmm.
about people like you.
Yes.
So what would
Mm-hmm.
happen is that, say for instance, someone's been diagnosed with cancer. Well, what we know is that when someone's diagnosed with cancer, it's a very scary diagnosis.
Absolutely.
It creates a lot of psychological trauma. And
Mm-hmm.
what that person needs is that person needs some hope, and they need a
Yeah.
holistic understanding of what they're going to be going through. And also knowing that there are other people who have gotten the same diagnosis who have defeated it,
Mm-hmm.
because it gives them inspiration to keep fighting. So
Mm-hmm.
what I put together was, it's like a membership, a monthly membership, where
Mm-hmm.
let's say you were diagnosed with cancer, any type of cancer, because we deal with cancer from the root cause, and so the type of cancer doesn't matter. So
Right.
you get diagnosed with cancer, you join the group, and you become part of a cohort. So let's just say
Mm-hmm.
you have autoimmune illness like lupus, or you have multiple sclerosis or Crohn's disease or whatever.
Mm-hmm.
In that cohort, and in that cohort, there's someone who's reversed their cancer, and then you have a healthcare practitioner like you, who
Mm-hmm.
basically is their accountability partner. So what
Mm-hmm.
you do is you would have like weekly meetings with them on Zoom,
Mm-hmm.
check up on them. Are you doing your intermittent fasting? Are you staying away from
That's wonderful. That's
carbohydrates?
wonderful.
Are you know what I'm saying? It's just almost like
Yes,
having a workout
it's
partner.
support. It's support
Exactly.
in real time. And so
Exactly.
I'm glad. I'm so glad. I got excited when you said that.
Yeah, yeah, but here's the side of it though. Um, you get paid because
Well, that's good too.
yeah, yeah, yeah. So what I'm looking to do is I'm looking to bring in healthcare practitioners, people just like you, who've been doing
Mm-hmm.
it, and you understand the allopathic thing, you understand the holistic thing, and you're able to understand what the person would be going through and to be able to guide them through. But then you also have someone in that leadership circle who is a cancer, someone who has defeated cancer. And so
Mm-hmm.
now that person who has been diagnosed with cancer has two leaders, somebody who is similarly situated, who got on the other side of it and defeated,
Right.
and then someone who's a practitioner like you.
Mm-hmm.
The two are the leaders. And then we'll have a another weekly group meeting for the whole group for people who have
Mm-hmm.
high blood pressure, diabetes. And what happens is that every week there's a different lecture, a different
Mm-hmm.
presentation by somebody who knows what they're talking about when it comes to.
Right.
So what happens now is that if you have a monthly, because I looked at the numbers, and because someone would be in this group, they'll be saving money in the food that they're buying, because most of the food you're buying is junk. You're wasting money on food. You're eating too much, and your pharmaceuticals.
We do eat too much. We eat
Yeah,
too much.
yeah, yeah. So I did the numbers, and most people who are sick, they are spending more than $200 a month on their sickness, much more than
Yes.
that. So what
At
I'm
the
saying,
least.
yeah,
That's low.
yeah,
That's low.
that's low. So what I'm saying is that you can join the community for as someone who's sick for $200 a month, and it's going to
Mm-hmm.
save you more than $200 a month. And then within probably 3 months, your problem will be corrected. But what it does is it allows. So imagine we have 1,000 people that are a member of the community, and they're all paying $200 a month. That's
Right.
$200,000 a month. Well, with that 200,000
Right.
a month, I can pay all the leaders of the cohorts. So if you're the leader of
Right.
the cancer cohort, you can get broken off something 5,000 a month or 6,000 a
Right.
month or 10,000 a month, whatever the number is that works.
And have good health outcomes.
Yeah, yeah, yeah. No, but you as the practitioner
I get that
would
piece.
be able, and you would have no overhead.
Right. I get that piece.
You see what I'm
But
saying?
yeah, I get that. Yes. But we're vested in good outcomes. We
Yes,
want the outcome.
exactly. You get good outcomes, but guess what happened now? The person who reversed their cancer is getting paid too as a leader.
Oh,
So guess what that means now? What that also means is that the person, and I don't know if you're still there because it looks like it froze up, but it also means
yes,
the
I'm
person,
here.
that means that the person who had cancer or who has cancer is now not only incentivized to heal themselves for their health, then to
Right.
heal themselves, they can get paid as a leader too.
That's awesome.
So now they have a job waiting for them if they can heal their illness, because now they become
Mm-hmm.
an example and a point of inspiration for other people who might be going
Right.
through whatever they're going through. So it's like this
Mm-hmm.
thing. Then within time, we can get enough money to build our own hospitals
Right.
around the world. So that's the
Wow.
model. That's the model that I have, and it's up and running right now. So for someone like you, definitely, I would love to invite you to be part of it as we flesh things out more. But
Absolutely.
I think you can be a
Absolutely.
great resource. Just your
Yes, I
spirit.
think
I
so
just, I
too.
just, I just love your spirit. So it's like
Oh,
I
thank
would just
you.
love to be able to work with you. You know what I'm saying? And to
Yeah,
make
maybe
sure that you're being compensated.
you're doing some awesome things, But I got real excited when you mentioned the network that you're building because I did my doctoral work was with people with type 2 diabetes.
Mm,
And that is exactly what I did. I set up a support program where people knew they were taught about different foods, how to prepare them, exercise. There still was that medication piece, but they had the ongoing support. And that ongoing support, the data showed that it improved their quality of life and hence the outcomes, the overall health
absolutely.
outcomes. So that's why I was so excited about that.
Yeah, yeah. I mean, great minds think alike. You know what I'm saying? Um,
Yes,
yeah, no one's gonna save us but us. That's the bottom line. That no one
right.
can save us but us, and you know it. I mean, you're in the healthcare community, and I've always said it. It sounds like a joke, but it's beyond funny because it's tragic. But
Mm-hmm.
anytime you are a black woman and you go to the medical system, they're looking to just give you a hysterectomy for the smallest thing. You can walk in with a headache. They say, "Oh, maybe you should get a hysterectomy." You can walk in, your fingernails got cracked, and oh, we give you a hysterectomy. You go in with a toothache, they want to give you a hysterectomy. So
I'm gonna go back to the health literacy and the individual engaging in the self. You know, I can't tell you the times that I have had the most frustrating conversations with women about managing um, women's issues. I can't tell you the times I, this thing like with elective C-sections,
Mm-hmm.
you know, it's like, what are you thinking? That is a very it's a very real area. This is a source of frustration for me when it comes to women's health, because we simply don't know our bodies anymore. And you know that's that's such a basic requirement of just being living in these bodies that we live in, just to know your body. I'm not even talking about being in tune with the self. Just know your body, basic things. But we're not there. We are not there. We're so far removed. So there's that disjointedness again. How
Mm-hmm.
we're everything is just so disconnected.
Right.
But I agree with you fully. The you're spotting hysterectomy.
Right. Smallest thing, hysterectomy. You know what I mean? Shoulder ache, hysterectomy. Like they don't, these people are crazy. They're absolutely crazy. They are crazy, And what it is, is population control. And we know what it is. We know what the history is in terms of you know, the Western Hemisphere and the medical history. Anyone's really interested and doesn't believe in anything that we're saying, just go get a book, Medical Apartheid, and
Right,
read that
right.
book, Medical Apartheid, and you'll understand that we're actually being very, very light in what we're saying. Like,
Yes.
you read the book, then you understand how dire the situation is.
Hmm.
Because people
There's
don't have
another
the
book I want to
context.
say.
Yeah.
It's called Medicine.
Yes, medicine,
Yes.
you know?
Yeah.
Yeah.
The
So,
information is there. The information is there.
yeah, the information's there, So, yeah, there's nothing more important in your health. Anyone knows that. When you're sick, you think about the days when you were healthy and you want those days
Right.
back. And
Right.
there's no amount of money that people would exchange for their health. So,
That's absolutely right. Absolutely right. I'm so glad you said that. That old debate. Oh, that old adage of, oh, you got to die from something. And I would say to people, I've never heard anybody on a dialysis machine say, oh, I had to die from something.
right,
No, they want their health
they
restored.
want their health restored. They want their health restored, and they'll do anything for it. Um,
That's right.
they'll do anything for it, but sometimes they won't do everything for it. You
Not
know what I'm
everything.
saying? Right? Which means
Yes.
like actually stop eating those donuts. Stop eating, stop eating that
All the
pound cake.
processed foods.
Yeah, all the
No,
processed
all
food.
the food items. The
Yes.
food items.
Yep.
But when you live in a food desert, you got a Dollar Tree or a General on every block with the
Yeah.
food items and
Yeah.
not the fresh foods.
Not the fresh foods, right?
Yes.
Yep. So, we're gonna work on that. We got some farm solutions for that too. But,
Yes.
I just want to thank you.
Thank you.
I want to thank you for making yourself available, not just to me in this interview, but it seems as if you're really making a difference in the community that you're serving
I
in
try.
Georgia. And you're spreading the good word of alternatives that they can. I know that you're limited in terms of the allopathic regime that
Hmm.
many are forced to undertake as licensed practitioners, but at the same time,
Right.
you're giving
That's
people.
key. Licensed.
Yep. Yep.
Right.
I understand it.
And
I
so
know
you're so
exactly how it
you're
works.
held. You're
Yep.
held to within a certain framework
Yep.
and a certain standard. Yes.
Yep. And that
That's
is,
key.
yep. And that's brought to you compliments of the pharmaceutical and insurance companies. And we know that it's not about necessarily healing people, it's about making money. And they have investors that they have to pay back. And that is the driving force of what they do. But at the same time, we are smart enough to realize that we're not living for them, we're living for ourselves.
You
And
live for
whenever
yourself.
we have, and when we have, and we're living for our families, and whenever we have an opportunity within their framework to give people alternatives, we give them the alternatives that we can within the context that we can do it. And I can see that you're doing exactly just that. And it's based on the
Mhm.
fact that you're seeing results. You literally are practicing evidence-based medicine, because when you take the herbal results olive leaf extract, you have the evidence based on the numbers. Your numbers drop
Right.
down. So
Right.
what more evidence is that, right?
Right.
So,
And it's been consistent. Consistent.
right.
It's not like,
It's not a fluke.
one and done, or
Right.
maybe not. No, no, no. It's been consistent. It's consistent.
Yep. So,
Yes.
I just want to salute you for what you're doing. It's a pleasure to meet you. Sometimes we meet each other online and we never meet each other and hear each other's voices or whatever. We've gotten away from really the basics of the human touch and the human voice and the humanity. So I'm just glad that we were able to connect, face to face, even though that this is virtual.
Yes.
It's just good to know. So when you
Yes.
respond to any text or any messages that I put online, I know who's responding. I know what your voice sounds like. I know your spirit and all of that. So it's been like, to me, it's been
Mhm.
a pleasure talking to you. And it's also been like emotionally moving to know that the products that we put together on at Herbal Results has made a difference in your life.
Yes, they have. Yes. I thank you so much
Thank you.
for the opportunity to speak with you directly. Thank you.
No problem. And I know you need to get something to drink right now for that cough. But no, thank you. Thank you so much. And if people wanted to get in touch with you I don't know what type of practice you have, but if people want to get in touch with you, particularly they're in the Georgia area and they wanted to get more information from you or about you, is there a way that people can get in touch with you?
I'll send you my email address.
Okay, so we'll
I'll
put your
send it to you
email.
directly.
Yeah, okay. And then, because people may be in the medical system in Georgia somewhere, they might want some information on how they can navigate. And I think you might be one of the people who
Okay.
could lead them, in the
Yeah,
right
I'll send my
place.
invitation. Yeah. I'll send my information to you so you'll have.
Okay, all right. Thank you so much. This is another episode with Herbal Results and also the podcast. And hopefully this has been informative and inspirational to everyone listening. And we'll just sign out and just say peace and blessings to everybody. Thank you, Doc,
Thank
for
you so
coming
much.
on. All right.
And you keep up the wonderful, impactful work that you do.
I will definitely. Thank you so much.
Thank you.
All right. Have a good day.
You too.
All right.